A fall is a sudden, uncontrolled, unintentional downward displacement of the body to the ground. Falls are a strong predictor of nursing home placement. Every year, between 33 and 50% of people over 65 experience a fall. Falls can result in people experiencing a loss of confidence, self-esteem, and reduced independence. A person who is on more than 4 medications has an increased risk of falling. Certain combinations of medication can increase fall risk. Medications may react differently in the aging body. Here are some key prevention tips that will help you decrease your chances of falling related to medication. Take your medications as prescribed. Always read the labels and follow the directions on your prescription. If possible, use the same pharmacy every time you fill a prescription. Some medications require blood pressure and heart rate monitoring. Do this every day if advised by your healthcare provider. Don't forget that alcohol interacts with a lot of medications. Check the label and ask your healthcare provider before drinking alcohol. It is important to keep a medication log so that you and your healthcare provider can keep track of all your medications. Update your medication log at every visit with your healthcare provider. List every medication that you are taking, including dietary and herbal supplements. Keep a log in your wallet or your purse so that it is easy to find. If you go to more than one pharmacy, show the log to the pharmacist at each store to make sure there are no negative interactions among the medications.
To fill out your medication log, start with writing your name, address, and phone number. Then fill in your medical conditions and your allergies, if you have any. Write down any important phone numbers you need to remember. Also include an emergency contact. Write down the names and phone numbers of each of your healthcare providers. Then fill out your medication table. Write down the name of each medication you are taking, your purpose for taking them, and the doctor who prescribed each medication. Also, write down the date that each medication was started and the date that each medication was stopped.
Here are some medications that have been shown to increase fall risk. Medications that affect blood pressure may increase your fall risk. Examples of these medications include Lopressor, Lasix, and Aldactone. Side effects of these medications may include dizziness, fainting, and low blood pressure. To help with these side effects, you should stand up slowly and monitor your blood pressure and heart rate. Antidepressant and anti-anxiety medications may increase your fall risk. Examples of these medications include Ativan, Ambien, and Zoloft. Side effects of these medications may include drowsiness, dizziness, lack of coordination, and low blood pressure. To help with these side effects, you should avoid alcohol and over-the-counter sleep aids. Stand up slowly and monitor your blood pressure and heart rate. Pain medications may increase your fall risk. Examples of these medications include Percocet, codeine, and morphine. Side effects of these medications may include confusion, dizziness, and drowsiness. To help with these side effects, you should avoid alcohol, take the medication as prescribed, stand up slowly, and monitor your blood pressure and heart rate. When you go to your healthcare provider or pharmacist, bring your medication log with you every visit. Talk to your healthcare provider about side effects that you have noticed. Bring any questions or concerns that you have. There are several health problems that may affect your fall risk. Cardiovascular issues may increase your fall risk. Examples of cardiovascular issues include heart rhythm problems and low blood pressure. Neuromuscular issues may increase your fall risk. Examples include muscle weakness, poor coordination, and unsteady gait. Musculoskeletal issues may increase your fall risk. Examples include joint pain and arthritis. Sensory issues may increase your fall risk. Examples include poor vision and poor hearing. Cognitive issues may increase your fall risk. Examples include confusion, impaired memory, dementia, and a previous stroke. Here is an example of outpatient fall risk screening tool. Answer the following questions. Have you fallen in the past 6 months? Do you have difficulty rising from a chair? Do you take any of the following prescriptions? Narcotics for pain, high blood pressure medications, diuretics, blood thinners, or heart medications? Do you feel dizzy when you get up from a bed or a chair? Do you have uncorrected vision problems such as glaucoma, cataracts, or blindness? Are you over 65 years old? If you answered yes to 2 of the previous questions, then you could be at an increased risk of falling. The timed up and go test is an outpatient assessment. This test should always be completed with a primary healthcare provider. The healthcare provider places a chair against the wall for added support. A cone is placed 8 feet in front of the chair. The healthcare provider instructs the patient to get up from the chair, walk quickly around the cone, and sit back down in the chair. The patient is allowed to practice 1 time. Next, the test is timed. If it takes the patient longer than 8.5 seconds to complete the test, then they are considered a high fall risk. Patients should be referred to physical therapy or occupational therapy for further evaluation. It is important to identify your fall risk so that you can change your personal risk factors. This can help increase the length and quality of your life. Talk to your healthcare provider about your fall risk today.